This story is incomplete unless I talk about my experience with the medical system. I have heard so many bad stories over the year, so of course I had a very low expectation and was a bit skeptical too. But it turned out to be very different. Initially, I doubted everything my doctor was telling me, and I thought that they are pushing me to the surgery too soon for no apparent reason because I had no serious symptom at that time. But then when I learned about it, I understood what they are doing and why. The report said is that the ejection rate was 37%, which means that body is getting only 37% of the blood heart is trying to send. This means that 63% of the blood is staying within the heart. But how can I believe it? I don't feel anything wrong. My diastolic pressure was always between 50 to 55 in last few months or maybe years. And it is supposed to be 80, and I always wondered why. Even though my systolic pressure is always kind of high. But now I know what was going on because the valve was not closing properly. As a result, the blood vessels, the artery, are not able to keep the pressure because the blood is leaking. As a result, of course, the diastolic pressure is low. It is so simple, but it never occurred to me. I guess the problem I experienced is that doctor always not communicating enough. It would be much easier to accept if they give the enough information. I had to learn actually in a hard way. I would expect doctors to explain little bit more in details. They do an honorable job and I have a utmost respect for them. At first, when I diagnosed, I was very frustrated because doctors say that it is very serious, but getting appointment was really slow. The CT appointment I got is 2 months away, and the appointment I got with cardiologist has 4 months waiting. But as it progressed and the new data started to come, things started to move very fast. So keep trust in the medical system. If it is serious, it will move very fast. I guess it is designed that way. I visited 2 surgeons and the experience I had was very different. The first person was very straight, had no filter and was not hiding anything. He said the surgery is going to take 8 to 9 hours and the heart will be stopped for 6 to 7 hours. The very next day when I visited another surgeon, he said the surgery is going to take only 3 to 4 hours and heart will be stopped for less than 2 hours. Now, how do I know who is right? Both cannot be right. I thought the first person said everything wrong and I was wondering why. He is the chair of cardiac department from one of the prestigious institute here and he should not have any time for any nonsense. The fact is that they both are right, but what they are planning to do is different. The first person is trying to do everything needed and that including repairing the valve, and which will give a better future. Nonetheless, that comes with increased risk of mortality. And the second person is going to replace the valve and do the minimum things needed because he thinks that there are no point of touching everything which are not needed in next 10 years. The first person said that there is a possibility that my heart won't come alive and I may die. And he said that on my face. And I got so confused after the visit. The second person was very different, very polite. He said not to worry, this is something he does every day. And the odds are very low. Both person is actually right, but the philosophy they have is different. The first person thought he should be honest and I should have the right to know the fact. The second surgeon probably thought that I am already going through a lot of difficulties and the least he can do is that give me some comfort. The medical system I experienced is very good, very organized and perfectly designed. The caregiver and nurses are so caring and very empathetic. Here I learned the difference between doing a job and doing it right. Now let's talk about the medical insurance. We hear a lot of bad stories, but I have nothing but the best experience throughout the journey. Every time I called for any questions to the customer service, I got the best experience. They showed the utmost empathy, maybe because the type of surgery I am going through. What was beyond my expectation was that they assigned one nurse coordinator who used to call every week to make sure that everything is going well. She actually taught me the entire process and how to prepare for the surgery. She addressed all my concerns and also gave her number so that I can call her anytime for any questions. In fact, I started feeling her like my own friend. I understand that some people may have a different experience because when the resource is limited, the experience can be different. I heard that some hospital they assign one nurse to maybe 3 and 4 patients. These nurses, doctors, they work 12 hours a shift and they keep the same energy level from start to end. That's amazing. But I picked one of the best hospital and the insurance I had was fairly good. And these things matters in critical situation, and I'm glad that I did that. The medical bill is going to be huge and no way I can afford this surgery. I hope you never need it, but surprise don't come with any notice. So try to get the best insurance you can based on the insurance terms like the co-payment or the deductible. They have covered everything as expected. So far I haven't seen any surprise bill or any denial. So that was my experience. Thank you for watching me. Take care.